Bismillahirrahmanirrahim. Approach to children. Clinical evaluation of any disease includes three things. First, history taking. Second, physical examination. Third, summarization of relevant findings. I am Dr. Muhammad Akram Lashari, Fellow of College of Physician and Surgeon. History taking is the foundation on which diagnosis of any clinical condition rests. A skillfully elicited history leads to an accurate provisional diagnosis, thus reducing the range of investigation and saving the considerable amount of time and money. When you enter examination hall for a long case, please don't forget to approach the patient from right side, introducing yourself, take consent and give a gift to child. This is the basic layout of history. First of all, patient profile, then presenting complaint and history of presenting illness. Third, history of actual disease. Fourth, PDF and DC. Fifth, binds and fix. All these we will discuss one by one in next slide. History taking is an art that begins with the basic information, documentation of name, age, sex, class, place of residence, and admission detail, either admitted through OPD or emergency, gives a clue about the disorder. Informant is a person who presents the history on the behalf of child. It may be mother, father, grandparent, or any person. Best person to give history is mother. History obtained from relatives like aunt or uncle who are not close to child is less reliable. If informant is not reliable, examiner should spend more time in cross-checking the history of child. Examiner should also note the informant intellectual level, awareness of problem, and emotional reaction to disease. Highly emotional mother can exaggerate the event of child's medical history. This is the first layout of history under the heading of patient profile. Second is presenting complaint and history of presenting illness. Presenting complaint should be recorded in chronological order of their appearance and should be recorded in informant or patient's own word. For example, fever for 9 days, cough for 7 days, difficulty in breathing for 5 days, and presenting complaint are usually not more than 3. Next is the history of presenting illness. History of presenting illness gives a detailed account of duration, site, severity, onset, progression, frequency, amount, characteristics or color, timing, aggravating and relieving factor, and association. Leading question can be asked at this stage. Medical terminology like dyspnea, polyuria can be used to describe the history of presenting illness. Start asking the question from time when child was normal. Elicit a detailed symptom-wise and system-wise history. Here you can see some mnemonics to describe the presenting complaint. After this, if patient is admitted, ask about the investigations, treatment, and condition of the patient, either improving or not. Then do the systemic inquiry. In journal, you can ask any other problem you want to tell. Otherwise, go head to toe. Ask one or two questions for CNS, eye, ENT, respiratory, cardiovascular system, GIT, genitourinary, and rheumatological disorder. Then third step in the layout of history is history of past illness and actual diagnosis. A history of past illness includes episode of similar or related illness in the past. If any such history is present, then you should inquire in detail about initial episode. Initial episode rounds around when, where and how. It means you have to ask detail of initial episode. What were signs and symptoms? Who was the doctor or hospital? What investigations and treatment was given? What was the duration of stay? And on discharge, what medicine were advised and its compliance, and any advice or dietary avoidance, and when were called for next follow-up, and on follow-up, either you come or not, and if you come, then what examination and labs were done. Fourth step is PDF and DC. P mean progression. Ask brief detail of every event and ask about the condition, either improving or deteriorating or static. D. Drug allergy and compliance of the drug. Ask about any allergy from drug or food, and he or she take medicine regularly or not, and in which dosage, any change in dosage or medicine. F mean follow up and monitoring. After how much time you go to OPD for checkup, or you change hospital or doctor. Any labs are advised to do either at home or hospital for monitoring of disease or its complication. D. Rule out differential diagnosis at this point. C. Complication of drug and complication of disease. Then our last step is binds and fix. Birth history, antenatal history, natal history, and postnatal history. In antenatal history, ask any complication occurred during pregnancy, or mother was taking any medicine, or any defect detected in anomaly scan. Natal history, either deliver by SVD or cesarean, deliver at home or hospital, either he was full term or preterm, and what was the birth weight, any complication occur during delivery, and any need of oxygen or admission. In postnatal history, after delivery, any shortness of breath, jaundice or fits occur. In immunization history, course of EPI injection has been given or not. If yes, then ask about EPI card. If not, then ask about the reason. Ask about any extra vaccine given or any side effect of them. Nutritional history, either he was breastfed or top fed when semi solid or solid food was started, either he takes iron rich food like meat, liver, or fruits. Is he or she taking street foods like papud, slanty, chocolates, and calculate the calories of 24 hours? Developmental history. Ask shortcut question. Is child physically and mentally normal? Was he started sitting, walking, talking with his peers or late? In relevant cases of CNS, ask in detail about gross motor, fine motor, social, speech, vision and hearing. Surgical history or blood transfusion. Previous admission due to any surgery or accident, ask about blood transfusion. If transfused, then ask about its indication, amount, frequency, or any reaction occur. After binds, we will move to our mnemonic fix. F mean family history and functional class. In family history, ask either parents or cousin. Ask about the similar illness in other siblings. In case of genetically transmitted disease like thalassemia, ask about any miscarriage or abortion. Is mother pregnant now? And ask about the anomaly scan done or not. Then is the functional class. There are two functional classes. Gross motor functional class, which tells us how much ambulatory he or she is, and AHA, American Heart Association functional class, which we do in cases of cardiac issues. I mean impact of disease on patient, parents and siblings. On patient, either he goes to school, how is he in study, and how is the behavior of child with his or her siblings. K mean knowledge of disease. Ask the parents what you know about the disease, its recovery, treatment, and complications. S mean socio-economic history. It means you ask what the father do and how much he is earning monthly. Either he can fulfill the expenses of child or not. Are they having any difficulty in the expenses of the child? In social history, you ask where they live, either in urban or rural area, how they have their home, either it is kacha or pakka, how many rooms are there, and how many person are living in that room. Ask about the sanitary measures and from which they enjoy the water supply, or they have any pets at home. If you forget to ask about the schooling of the patient, you can ask here. Thank you so much for watching. Hopefully it will be helpful for you.